In the same way that you cut open that steak to make sure that it's the temperature that you requested, ask questions of your partner. Know the facts before making a decision to be close or intimate.
Austin Public Health asking the community to be careful about monkeypox. There are 9 confirmed cases and 8 presumptive cases in the Austin-Travis County area. It can spread through skin-to-skin contact, things like sharing utensils or be on clothes and linens. Many patients have a fever and a rash that can show up on different parts of the body. As far as testing, health officials are collecting samples from doctors' offices. More labs will soon be processing samples too. Right now, vaccines are for people who are close contacts with an infected person. The plan is to scale up as more supply comes in.
We do have ways of combating this disease for those people who are at risk for severe disease.
Austin Public Health says the cases they've seen have mostly been in males in the 20 to 49 age group. None have been hospitalized. Generally, most cases clear up in about 3 weeks, but people in high-risk groups may have more severe cases. Overall, the mortality rate is less than 1%. At-risk groups include those who are immunocompromised, pregnant women, and young children.
Monkeypox is absolutely not a disease of the gay community. Rather, it's circulating right now amongst a small subset of this population, but that we know historically that this virus has similarly impacted other very different groups of people in the past.
He says in Europe,
the vast majority reported intimate skin-to-skin contact amongst same-sex partners. Now, while a significant number of those diagnosed with monkeypox were also living with HIV.
Doctors say don't scratch at lesions or you could end up with a secondary infection. And if you're cleaning after an infection, wear a mask, gloves, and eye protection. Health officials are also working with schools on infection control.